Hello, I'm Mike Deegan, Group Chief Executive. As you will know, this year has been unlike any other. The COVID pandemic has been unprecedented. The NHS response has been truly exceptional, and MFT played its full part. Although we saw the peak of the infections in our hospitals and critical care services in April and May, we're not complacent and are working hard, clinically and operationally, to support staff and patients. We have contingency plans in place to respond to any further surges in infections and to ensure we can restore and maintain planned services and care. We're also working across GM and with regional and national leaders to reduce the spread of the virus, and with researchers, industry, public health and academic colleagues to support the development of a vaccine. So even though we've passed the first peak, we expect that COVID and recovering from its impact will continue to dominate the landscape. MFT has a long-standing set of strategic aims which will stand us in good stead as we recover over the coming months and years. They are to complete the creation of a single hospital service for Manchester, MFT, with minimal disruption whilst ensuring that the planned benefits are realised in a timely manner. To improve patient safety, clinical quality and outcomes. To improve the experience of patients, carers and their families. To develop single services that build on the very best from across our hospitals. To develop our research portfolio and deliver cutting-edge care to patients. To develop our workforce, enabling each member of staff to reach their full potential. To achieve financial stability. The task for the year ahead will be to recover from the pandemic in a way that also takes forward these aims. I'd like to share with you some of our key developments for the longer term. The NHS long-term plan, with its strong focus on prevention, out-of-hospital care and joint working across health and social care, sets the framework for our own planning and is reflected in our MFT strategy. COVID highlighted that staff are our greatest asset. The NHS People Plan, published in August 2020, highlights the need to develop an NHS culture where we support, value, include and develop our staff, and together explore new ways of working and delivering. A challenging set of objectives, but one MFT is keen to harness and build on the work we already have in place. The work to bring North Manchester General Hospital into MFT is progressing well. An interim management agreement means that since the 1st of April 2020, North Manchester is being managed by MFT, and the leadership team at North Manchester forms part of the MFT group. North Manchester needs very significant levels of investment to reorganise the site and provide appropriate facilities for delivering high quality modern healthcare. So we're working with key partners, City Council, local commissioners, to develop really ambitious plans to create an integrated health and social care campus, new housing, education and employment opportunities that will help to address some of the long-standing health inequalities in this area. Working across systems, including NHS, local authority and voluntary sector partners, was essential for dealing with the pandemic and is equally important for the recovery phase. All areas are required to embed and accelerate joint working. Collaboration is right at the fore. That is, trusts working together to improve services for patients. In Greater Manchester, we're ahead of the game with our Provider Federation Board, which brings all the providers together. It will be important that MFT continues to play a leading role in this. As the largest trust in GM, what we do has a major impact on the overall GM picture. And this is an opportunity not only to improve services for our patients, but also to address some of the health inequalities that have really been exacerbated by COVID-19. I'd now like to outline some of our short-term priorities. Our teams are working hard to safely restore services, beginning with outpatient services and bringing back a range of specialties, diagnostics and other services. However, it's not just business as usual. We're also transforming the way we deliver care, learning from the innovations that supported emergency and critical care and maternity services during the peak of the pandemic. Much of this is in fact expediting the plans that we already had in place through the development of our strategy. For example, our Attend Anywhere video consultations have been really well received by patients. We'll keep using this and other technology where clinically appropriate. Online meetings have enabled our teams to continue working and communicating effectively, another innovation that will remain. Proudly, MFT led on the creation of the new NHS Nightingale Hospital North West in Manchester's Conference Centre. This remains on standby in case of further waves of coronavirus. We're also prepared for the usual winter flu outbreak, which inevitably puts extra demands on our services and people. The well-being of all our staff is paramount, and the pandemic highlighted the particular vulnerability of colleagues from a Black, Asian and minority ethnic BAME background. Alongside personal risk assessments for all our BAME staff, we've established a BAME staff engagement group to listen to the concerns of colleagues and put in place plans to support them. Modern, high-quality environments are another key factor supporting excellent patient care. We have a bold vision for the redesign of the entire Wythenshawe Hospital campus, which will see the development of brand new clinical buildings. This supports our plan to deliver single services across all our hospitals, but is dependent on securing clinical and other income. Significant investment is also going into developing our adult and paediatric emergency departments on Oxford Road, and our new helipad is nearing completion. Turning to our infrastructure, a key development for us is a new electronic patient record. This will help us realise our ambitions by introducing cutting-edge technology to support clinicians to deliver world-class patient care. The new system has now been procured, design is underway, and we aim to have it in use from autumn 2022. From this outline, you will appreciate the health and care services nationally and locally will face both challenges and opportunities over the coming months. I can assure you that at MFT, we have the people, skills, resources and commitment to continue delivering high quality care to all the communities we serve. Thank you for watching our annual members meeting films. Thank you for your support.
Thanks, Mike. As you say, we should not underestimate the challenges ahead. We're working hard to resume planned patient care while also keeping our hospitals safe and complying with the COVID-19 regulations. I know our teams will be doing their absolute best to achieve the safe and gradual recovery of our services, and we're very proud of their outstanding commitment to our patients, their families, and to each other. I'd also like to take this opportunity to personally thank all those governors who are standing down this year and who played such a pivotal role in the creation of the Trust in 2017. You held us all to account and you have made a huge difference. Thank you. It's our privilege to provide outstanding care for you and your family and all the communities we serve. We're also committed to making MFT an outstanding place to work for our staff, attractive to scientists and researchers, and widely recognised as a regional, national and international healthcare leader. Thanks so much for your support. It's our privilege to serve you here at MFT. Thank you.